According to the 2011 Kosovo census, Roma, Ashkali, and Egyptian communities comprise just over 2% of Kosovo's total population. All social and economic indicators point to their disadvantaged position. They belong to the poorest communities in Kosovo. To address multiple challenges these three communities face, the government of Kosovo developed the strategy for integration of Roma, Ashkali, and Egyptian communities in December 2008 and the accompanying action plan in December 2009. The short video documentary presents good practices of some agencies of the United Nations, other international organizations, and local NGOs pertaining to the work with Roma, Ashkali, and Egyptian communities in Kosovo. To be recognized as a person before the law is a fundamental human right. A large proportion of Roma, Ashkali, and Egyptian communities in Kosovo remain unregistered and lack personal identification, without which their fundamental rights are denied in various areas, including social protection and welfare, employment, education, and health. In accordance with its mandate on prevention and reduction of statelessness, UNHCR remains actively engaged in providing legal assistance to all persons in need of personal documentation, in particular birth certificates.
It should be noted that according to the law, failure to register life facts or life events will result in a fine between 50 to 100 euros. With aim to improve the situation and release unregistered Roma, Ashkali, Egyptian communities from financial burden, the authorities waived these fees only for these communities during 2012 and also in 2013. This have had a positive impact by enabling Roma, Ashkali, Egyptian community members to easily access the procedures through simplified evidential requirements and release from payment of fees.
Research shows that Roma, Ashkali, and Egyptian communities have generally low awareness on reproductive health, modern contraceptives, STIs, and HIV/AIDS, and the overall health status among the population is poor. UNFPA has been working with Roma, Ashkali, and Egyptian communities and local NGOs to raise awareness among young men and women about their reproductive health.
We went through their NGOs that are existing within the community, and these NGOs, these Roma NGOs, actually used their volunteers and peer educators who conducted all activities within their community. So we didn't send some outsiders within the community, but their community members were those who actually carried all activities.
Through training that was organized by UNFPA in 2008 through 2011, we found an increased awareness of 15% among the Roma, Ashkali, and Egyptian population related to the importance and use of contraceptives, which shows a positive and satisfactory trend.
The safe and dignified return of displaced persons to their homes is recognized as a fundamental right, both in international law and in the legal framework in Kosovo. Despite Kosovo institutions and international actors' continued engagement on the issue, Kosovo's internally displaced persons from Roma, Ashkali, and Egyptian communities are still in need of durable solutions, and those who returned voluntarily or through readmission are still confronted by serious obstacles to their sustainable reintegration. Safe repatriation and support upon return to Kosovo, including grants and skills training, is provided by IOM.
Projects linked with income generation are perhaps one of the best options to stop them going back abroad, but also generating an income that will help them in providing the needs for their families. And I will say that training them and preparing them for the full reintegration process will be a key aspect.
When I arrived in Kosovo, I went to IOM office and they offered me really good services. I thought I was in Belgium. They gave me all that we had agreed upon before I left Belgium. They paid my house rent for 1 year and gave me the tools for work. Of course, I was happy to return to my home country, but it would be good to have more prosperity, to expand my business and to employ more people. But the problem is that I do not have enough financial resources, tools, and that the house I live in is not mine.
Illiteracy, the lack of preparation or vocational education, gender and ethnic discrimination are serious obstacles for the integration of women, resulting in higher unemployment and living conditions compared with the majority population or with other minorities living in Kosovo. Over the last decade, UN Women has worked with women and girls of the three communities on various issues such as women's empowerment, violence prevention, education, and capacity building of local NGOs.
From 2006, through our partner, we supported them through mentoring and coaching every day. For example, through all these years, some young girls who were involved, they finished their studies and they are part of, and they are, contributing a lot. They did the monitoring of strategy for integration of RAE community within Kosovo society from gender perspective. It's a great, survey and study and report to read and to see which gaps they find out. And it's a very strong advocacy tool.
UN Women is a good model for other donors to learn how to really support a starting NGO to achieve results and to ensure their sustainability. Provision of long-term support and capacity development of staff is the best way to help an organization achieve their desired effects. For the first time, our organization learned from the Center for Gender Studies on how to establish and manage an organization, best workflow processes, and how to implement those lessons in practice together with our members. The education of Roma, Ashkali, and Egyptian communities in Kosovo is characterized by low rate of enrollment in pre-primary education, a very small number attending secondary education, college or university, and high dropout rate from school, especially among girls. To address some of these challenges, UNICEF has implemented an out-of-school approach with several municipalities in Kosovo.
UNICEF has introduced child-friendly school concept in schools, and that has been done by promoting inclusive education. Specifically, we have supported access, prevention and dropout of Roma, Ashkali and student children from school, and that we have modeled into an intervention that has meant to create a mechanism at the school level for addressing the issues of dropout in school of Roma and Ashkali and Egyptian children. Today, this has become a legal requirement for all schools, and part of the intervention was very much supported with the work that we have done through learning community centers with Balkan Sunflowers.
Since we started with the Learning Centers Network program, we had many successes. The dropout decreased, the attendance of children in school is increased, the success of children in school increased, the parent involvement in school increased, and most importantly, many people are continuing the secondary school and university. In Kosovo, for example, in 2006-07, we had only 2 students in university. Now we have more than 30 university students in Kosovo. In the same place, we had only 6 students in secondary school. Now we have more than 70 students in secondary school. And this is also good for children, because we have role models who are showing to the younger children that education is very important, and with good education you can have better life.
The lack of budgetary provisions to implement the strategy and action plan at the municipal and central level is a continuous concern. By March 2010, the only funds earmarked to cover the costs for implementing the reintegration strategy was in the Ministry of Labor and Social Welfare for 2 shelters to accommodate returnees. None of the other aligned ministries and none of the municipalities had budget lines for the reintegration of repatriated persons.
The OSCE has had a particular interest in the implementation of the strategy and action plan, and because of that we undertook 2 monitoring policy report publications. Essentially, both reports concluded that there were really quite serious problems in terms of the implementation of the strategy and action plan. That in general, very few of the sectors had seen substantive progress, and that overall there were key problems in relation to government coordination, allocation of sufficient financial and human resources, very poor monitoring and reporting, including some of the initial assessments that were envisaged in the action plan, almost none of which have been undertaken, and a significant problem with the lack of awareness in the public and also within government institutions of the commitments made in the strategy and action plan.
There is 11 chapters talking about different problems that the Roma and Ashkali Egyptians are facing, but the problem is it's again the mechanism system of implementation. It's in general, I think most of your audience can agree with me. In Kosovo we have perfect laws in the paper, perfect strategy, perfect action plan, but then this implementation of these documents need to be done. Then it's a problem that there is not enough effort from the side of the institution, but from the same time there is not enough effort from the side of the community, and that is the reason why I'm saying that in the beginning of our interview that we need to create stability inside of the community. So
UNICEF's cooperation with EUGG in the areas of monitoring and reporting has resulted in the progress report of this year that for the first time came up with a quantifiable measuring of results for Roma, Ashkali and Egyptian communities. Moreover, we have supported the prioritization of activities of the current strategy and action plan together with the technical committee, which will allow to prioritize activities against results until 2015. This year's progress report has revealed that many results have been achieved by the aid community in cooperation with the Kosovo government for the Roma, Ashkali Egyptian communities. For example, a steady increase in enrollment rates for Roma, Ashkali Egyptian children across all school levels, increased awareness about reproductive health and nutrition issues, and results for civil registration. However, numerous challenges remain. For example, in the area of health, when we think about lead contamination, for example, in the area of participation empowerment, but also in the area of education, when we think of the low levels of pre-primary school enrollments of Roma, Ashkali Egyptian children. UNICEF's intervention will even more focus at municipal level to translate monitoring findings from the central level into reality on the ground, and to focus on key outcomes for Roma, Ashkali Egyptian communities in the next 2 years. Because in the end, that's all that matters, to translate the current policy commitment and future policy commitments after 2015 into strong realities on the ground, into strong and efficient municipal action and work plans, to translate that into outcomes and results for Roma, Ashkali Egyptian communities.
While the international community in Kosovo continues to support Roma, Ashkali, and Egyptian communities, a lot remains to be done for full implementation of the strategy by 2015. It will be important to advocate for further scaling up of emerging good practices and sufficient resource allocation to ensure the full realization of human rights of the 3 communities in Kosovo. Continued support to the implementation of policy commitments at municipal level remain crucial to have monitoring results translated into powerful municipal action plans and work plans for better results for the Roma, Ashkali, and Egyptian communities.